Zambia Blog Talk Radio.
Do you want to promote your business on Zambia Blog Talk Radio? Yes, that's right. Live on Zambia Blog Talk Radio. To book your spot, just make a donation by picking from the following categories. To get started, just call or WhatsApp the number on the screen and you'll be good to go. Live on Zambia Blog Talk Radio every Saturday for 1 full month. And it will stay on the recorded shows.
Hello, everybody. Welcome to April. Believe it or not, it is 1st April 2023. This year is flying. It's just flying by like I never believe it. We do appreciate you joining us. Please tell a friend that the ZBTR is on. We've got an interesting topic today. It's a follow-up of something we started on February 25th. Yes, most of you remember when we had a discussion on drug and alcohol abuse amongst adolescents in Zambia. So we are continuing because this is not just about having people who are involved in the work come on and we talk about it. It's about finding solutions to issues that are happening in our great nation in whichever way we can participate or contribute. So that is the purpose of these discussions, to guys, to inform, to get you involved. You remember actually one of my today, she did mention and encourage all of us to say we need to start a movement. So today, this is my objective of us doing this. And for me, bringing back Dr. Connie Osborne, former Director General, National AIDS Council, and she's also the patron for my Zambian responsibility, who are spearheading movement or this fight against alcohol and drug abuse amongst adolescents. Dr. Osborne, welcome. Thank you for joining us again this weekend.
Thank you. Thank you so much. And good afternoon, everyone who's watching this show.
Excellent. And one of the things that came up when we had this conversation was the role, involvement, the participation of the church. So the stakeholders conference, which was held last weekend, I believe, we had, I think, about 2 or 3 pastors, you can correct me, joining us from the great city of Chingola, my wife's village, Rev John Lumbwe, the senior pastor at Hope for Life Church. Pastor Lumbwe, welcome.
Thank you very much, and good afternoon, everyone that is listening to us at this particular time. We're glad to be with you. Yeah.
Excellent. Can you believe it's already April? I thought we just said Happy New Year last week.
I'm telling you.
Imagine. I can't even account for this time. It's 3 months already into the year. We have
3 months. Yeah, 3 months has already gone by, and
amazing.
But you
yes,
know,
Dr.
it's
Connie.
a sign of age, eh? The older you get, so
no,
it's reminders
about
that.
That
reminder not too good.
So
yeah, it is.
Yeah, what it is.
Wow.
It also speaks to the point of the urgency of this discussion matter that we have at hand. We
Absolutely.
do not have the time. Yeah, what I thought of us doing, Dr. Connie, Reverend Lumbwe, is to sort of do a little bit of a repeat of what we did on the last show, Dr. Connie. I'm still going to ask that pertinent that we addressed on the first question. For the sake of somebody who's listening to this and they missed the first show. So please tell us, what is the extent of drug and alcohol What is the extent are we talking about here?
Yeah, and I will confine myself to Zambia. To tell you the truth, we don't have very
Yes.
good statistics on the extent or magnitude of the problem. We maybe know something about alcohol because there's been quite a number of studies related to alcohol. But I don't think we've done like a national study to say what exactly is the magnitude. So here's what we know. We know that it's a problem because, you know, in the papers, at least once, twice a week, there's some grisly story going on about a young person killing parents, killing girls, because apparently they were under the influence of drugs or under the influence of alcohol. In terms of drugs, we don't even have any studies. We have studies on alcohol, but not many, if any, studies related to drug use. Now, Zambia used to be called a transit route, but we know that now it's actually
Yes.
a destination for some of these drug things. And people smuggle in all types of drugs. You're talking of LSD, cocaine, ecstasy, methamphetamines, all kinds of substances. But in terms of alcohol, I mean, alcohol is just available everywhere. Zambia, we've got Zambia breweries, but we've got all sorts of alcohol. And then people are not just using one drug. There's a mix. They use a mixture of drugs. The meeting that we had, I think, a week ago, 2 weeks ago, the conference that we had on drug and alcohol abuse. Well, we had presentations that really showed that the problem is serious, but we don't have the numbers. You can find drugs anywhere. There are hotspots. I don't know about the Copper Belt, but in Lusaka, you have several hotspots like Chibolia. If you go there, it's sad. And people who don't live in Chibolia, who are addicted to some of these drugs, they actually literally have to pass through Chibolia, get their fix before they go to work. That's how bad it is.
Wow.
So it is, it's terrible. It's terrible.
Yeah.
Wow. Doctor,
Yeah, it is.
Pastor Lumbwe, every time we start about it, every time we start talking about this, Dr. Connie Pastor, I just get concept. You've alluded to the aspect of Zambia transitioning from a transit point to a high consumer destination for drugs. Isn't this just an outcry to an already existing situation, except that we just realized that it has become slipped out of our hands? Because Lumbwe, I remember, we all remember very well, Dr. Connie, Kachasu, Mandrax have been issues in Zambia for a long time. I don't know what your response is. These things have been there from the UNIP eras. I can remember that.
Yeah, no, you're right. But I think when we talk about being a transit country, it's maybe for the hardcore drugs like cocaine, like heroin, LSD. So only these specific hardcore drugs that were passing through Zambia and going to the States or to Europe or wherever. But otherwise, there are others, like you mentioned, Mandrax. But people now, they have discovered that, even cough syrup, even Valium, even some painkillers, you can get them off, over the counter. You don't even need a prescription. So it's people will come from South Africa because maybe they're more strict in like you can't just buy a painkiller that has codeine or that has tramadol, but in Zambia you can over the counter. So it becomes a destination because these things are readily available.
Yeah. Maybe to add a voice to that, Vanessa, really, like you say, we've had this, like you talk about Kachasu, you talk about the mandrax issues. Yes, we've had them. But when you talk about mandrax and all those things, then many times I think, like Doctor said, the transit aspect was so real in it because mostly they were going to sell, but yes, we had all these around us, a little bit of that, but today it has gone out of control, because you would agree with me that in those days, to have women really into these things, it was a taboo. We didn't see a lot of women getting into this, but get in there today, get into the kitchen parties. It has just gone out of control. Women have joined in, unlike the old times when only men were seen to be taking these things. But now the girl child is into it. They are taking all this, so the extent has really gone high. But of course, there are a few studies that are really going on. The number of males is showing that it is more than the number of women, of course. The book has conducted a survey on drug and drug abuse, but of course these are being alluded also to economic degrading situation, lack of self-control, peer pressure, weak parental guidance, which are some of the things like really that is at the core of the involvement of the church to be able to hit to the core, availability of drugs like what Dr. Connie is talking about, very, very much available for us around alcohol in the community. These are instigating factors for increased abuse of drugs and alcohol amongst our children and pupils in Zambia today.
Yeah.
Well, I need to ask a personal room, but since we are in time, how yourself getting involved in this?
Come again, what did you say?
I said, how did you find yourself getting involved in this fight against
okay,
what is going on here, the alcohol and drug abuse?
Well, yeah. How did I find myself getting involved in this?
Somebody would just say, just worry about preaching. How do you respond to that?
I've been preaching the last 25 years. And in my 25 years of pastorate, the bigger component of pastorate also deals with counseling. You're dealing with the lives of people. And actually, I have seen the numbers of people that I am counseling day by day going up, especially when it comes to issues of alcohol abuse, ranging from the children all the way to the parents themselves, and the numbers is going up. And so these are the things that we are dealing with as pastors on a day-to-day basis. So that becomes a concern for me as a pastor, that these things are happening in the church. How are we going to respond to this? Just timely with that, I got an invitation to be part of this consultative meeting and just get into it and be able to consult with other professionals, which had quite a cross-section of stakeholders that came across, which was so good because there was quite a lot of information flow that was around. So that's how I got involved. On a personal case is what I am dealing with on a day-to-day. And this is right in the face of a pastor today. And that's why there is need for a pastor to be properly equipped to handle this, because we are putting a blanket on it and just saying it's a demon. But people are addicted. People are in a mess and they need to be helped. And if the pastor is not going to be properly equipped to handle this kind of constituency, it's a big constituency that the pastor is dealing with. And if he's ill equipped, we are going to destroy a lot of lives. So I got interested that can we put our hands together. This thing that we are fighting is multi-sectoral, and so we need to be able to face it that way. Hence my involvement, Brother Nathan.
Yeah. Nathan, if I may just come in there.
Go ahead.
Yeah, and I want to challenge Reverend to maybe do a little study on his what you call it, congregation, your family, the people that come to church.
Yes.
Because I believe that a lot of your
membership or constituency.
I believe that most of the members of your church, the families there, they have one or two people who are either alcoholics or are on drugs.
Yes.
But the problem is when you have a family member who is like that, you are embarrassed, and people hide that issue. So you, as the reverend, you are preaching to people who are depressed. They can't come out and say we have this problem, because then it's like they failed as parents. So I would like to challenge you to just find out from your membership and maybe do an anonymous questionnaire to say, do you have a member of your family, one alcohol or drugs or both? They don't have to put their names, but just a little survey, and that will be very revealing. And maybe from that you could then come up with a program to address the issue, to talk about it. Because drug and alcohol abuse in a family, it's something that people don't like to talk about, to bring out in the open. And yet, I think when you talk about it, then you hear the experiences of others, then that might help, help you. In fact, in the workshop that we had, the meeting that we had 2 weeks ago, we had testimonies from survivors of drug abuse. And one of them who gave a testimony was son of a pastor. And he's done very well. I mean, he was bad, but he's done very well. He now has a home.
And he's been to Chainama 17 times. You remember?
Yeah, I've forgotten his name. But you know him, Daniel?
Yeah, Daniel. Yes. He'd been to Chainama 17 times. He went to Russia to go and study. He dropped out of school. It's a mess.
That's the person.
Yeah.
Rev Lumbwe, still with you before we transition to the stakeholders conference that just took place. There is, and I'll do this, even before we started the show, Mama Connie and I were chatting. There is this outcry from people, and a lot of friends said to me when they saw the flyer that you were going to be on the show, they said to me, can you please address this issue? The church pastors in Zambia, they seem to be so loud about this issue to do with sexual orientation, but you don't hear anybody say anything about this issue. I don't know what your response to this is.
I think it is people are ill-equipped into it, because when what this demands, alcohol abuse really is demanding a very serious response from the church, and we need to we need to properly be equipped, be prepared to be able to handle and tackle it. Yes, there is all that around the LGBTQ stuff, and there's an outcry that is loud on it. But what about issues of alcohol and drug abuse? What I would say really on this matter is that it's something that is coming out now very seriously, and a few clergy have gotten on the board to be able to begin to address, like Dr. Connie was saying. Pastor, can you be able to look at your constituency, begin to, can you look at, do a survey of some kind, and then based on the response, can you put up some program? Can you begin to intervene into it? Yeah, so a few people have gotten interested and begin to get the numbers, because this is in our face. We are dealing with this on a daily basis. And so we are not always going to say, no, it is a demon. Let me cast it out. You do all that, and the person is still addicted. There must be a process of rehabilitating this person, and that calls for us to be properly equipped as clergy. And I think it's a challenge to us in this time and season, that we need to go beyond what is on the surface and begin to get equipped, get information, get prepared to be able to deal with this. We're dealing with it on a very small scale, but I think we need to step up and become a little bit more loud. We need to be very deliberate and intentional about it. I really call upon my fellow clergy to be able to look at this bomb that is with us now, because is taking away our next generation. It has hit our next gen very hard, and if we are not careful, we can have a generation wiped out. We must have a robust approach, like the way the robust approach was to HIV and AIDS. It was multi-sectoral in nature. Every corner, everyone is talking about HIV and AIDS. They are peer educators, they are youth corners. Everyone is approaching it. The church has not been left when it comes to HIV and AIDS. They are involved. I think that voice, we need also to take it up and be able to approach the issue of alcohol and drug abuse that way, in a multi-sectoral sense, and be able to be involved and mitigate it at this stage. Yeah.
Excellent.
I agree.
Dr. Connie, what was the theme of the just ended stakeholders consultation conference? Who were the stakeholders represented?
Yeah, so the theme was just simply trying to, scope and magnitude of drug and alcohol abuse, focusing on adolescents and young people.
Okay.
So what we were trying to do was to try and understand the scope and the magnitude. We had presentations from the Drug Enforcement Commission. We had presentations from the University of Zambia School of Medicine, the Psychiatry Department, and we had presentations from Chanama Hills Hospital, which, as you know, is part of the Ministry of Health. And really, from what they presented, you could see that the problem is big, but we didn't, from those presentations, there were stats on a global level, but not very good stats from a Zambian perspective. The one thing that was clear was that alcohol-related mental disorders were the number one cause of outpatient as well as inpatient admission in those hospitals where they have a mental or a psychiatric unit. So the stats are coming from the units, mental and psychiatry units. But if you look at the hospitals in general, including those hospitals that do not have mental and psychiatry units, we still see a lot of alcohol and drug abuse related disorders, and then you have to refer them. If you're in Lusaka, you have to refer to Chainama or UTH. If you're in the Copper Belt, you'd need to refer to Ndola. And then if you're somewhere in the southern province, it's Livingstone. So I think there are only 4 hospitals. Chainama,
what if you are in Nakonde?
Nakonde, I guess, I don't know what's the nearest.
Mwinilunga, where do you refer to?
Nakonde, I think you go to Ndola. That's in the northern province.
They said, I think they say all the provincial hospitals, yes, that they can be referred to. Yeah.
They can be referred
to all the provincial hospitals, yes.
Yeah, but we have a serious shortage of psychiatrists.
Yes.
And mental, and where we have like mental health nurses, some of them are not even practicing that skill. They are just general.
They've gone into administration.
Yes, they've gone into administration. Because we were given presentations and we were given the numbers, and it's pathetic. Really, I don't know. It's really there is a serious problem in terms of mental health in general, and then even worse for people who may be specialized in harm reduction, for people who are addicted to alcohol or to drugs. So in terms of participants, I attend a lot of meetings, but this meeting I was pleasantly surprised. It was very productive. For 2 days, we had about 30 participants. We had the Drug Enforcement Commission. We had Lusaka Municipal Council, National AIDS Council. We had Chainama. We had UTH. We had, of course, My Zambia, My Responsibility. There was Action AD, Action Direction, something like that.
Yeah.
And then we had some private NGOs.
At the University of Zambia?
Yeah, the University of Zambia School of Medicine was there, the psychiatry department. There was Decisive Minds, which is an NGO that focuses on persons who use drugs. Zambia Correctional Services.
Zambia Correctional Services.
Yeah, they were represented. And
Zambia Police.
Well, Zambia Police, Zambia Correctional Services, the same, more or less the same, I think, because Zambia Correctional Services is a department of Ministry of Home Affairs.
Yeah.
So,
they lock you. The correctional services, they lock you up. The police are the ones who charge you or whatever the issue is.
Yes.
Here's my big. You see, we both you, Lumbwe, Dr. Connie, at the level at which you have worked in yours, you have done meetings, conferences, and I'm sitting and I'm saying to myself, okay, conference after conference, like the saying used to go a few years ago, after party, way forward, Lumbwe. Dr. Connie, what is the way forward? When you were here last time, you challenged us to forming a movement, Lumbwe. I want us to start a movement conversation. What is the way forward? And as far as I'm concerned, China might be overwhelmed. I don't know why we don't have 10 psychiatric hospitals in Zambia up to now. But every time we have new government officials, they get new cars. Okay, let me stop there.
Yeah, well, I mean, we did come up with some resolutions. And the first one was, it's one thing to talk about, well, within the movement, to talk about drug and alcohol abuse. But do people have the capacity to deal with this issue? It's a specialized area.
Okay.
So one of the things that we agreed, we resolved, was to have to build the capacity of community-based and NGOs, I guess, including faith-based organizations, to build their capacity to be able to address the issue of drug and alcohol abuse in terms of prevention, in terms of treatment, and in terms of rehabilitation or recovery. So we can talk about it. I mean, myself, I have family members, I have friends who have alcohol, and some of them are they abuse drugs. But I don't think I'm equipped, to know exactly what to do. I can talk and say, this is bad, but I'm not in their shoes. This is an addiction, it's an illness, and it needs specialized care. The other thing that we resolved to do, so in line with that, we had participants from the States, from Metro State University in Minnesota, and they have offered to do an intensive course for 4 weeks, a number of people on
to who?
So we'll have about 6 from the participants that we had.
Yes,
who will participate? Who will participate in this course?
Mainly representatives of NGOs that were in the what's this?
In the consultative conference. So
in
we'll have about 6
conference.
of them go. Yeah, we'll have about 6 of them get to attend that. In May.
And six is a drop in the ocean. I hope to weigh in this. I hope to weigh in the sense that, you can teach 6. Remember, we are a population of 18 million. 18 million Zambians.
19.5.
Yeah.
Yeah. So
19.5.
Yes.
Yeah.
Yeah. So they'll be trained in the movement and the NGOs, but we need something a little bit more than that. Now, here's the thing. The government, I hope it's going to happen. They want to build a national rehabilitation center in Lusaka. And I hope that it's going to be a state of the art. I hope that it will be a center of excellence. I hope that within that, there will be maybe an institute of drug and alcohol abuse research and, disorders, so that we can train more people in terms of addressing this issue. So it's good if we're going to have this rehabilitation center. And we hope that some of the stakeholders who were in the meeting will be involved in terms of weighing in on the way it will be structured and what the function will be. I personally wish to get crash on the conversations on this. On the conversations on this, because I think we probably need it. There should be training, there should be research, there should be teaching. Training and teaching is the same, but there should be research, but there should be service. The other thing that we resolved to do, people made... Yes, please. Yeah.
To that point, before we lose this trend of thought, Dr. Connie and Lumbwe, Billy is asking, this is a related question to what is on the table right now. What's the best way of training?
Of what? Of training? Well,
yes.
You know, we have in Zambia, I think at Chinama, they have a training course for mental health nurses. And usually within that curriculum of mental health, there's always drug and alcohol abuse. You also even have people like psychiatric nurses as well. Yeah. And doctors. But this will be a deliberate training on harm reduction, on substance use disorders. Yeah. So we want to have lecturers, you know, it must be like you can get a diploma, even a degree, just specialize in harm reduction. But beyond that, that's
specialize in harm reduction. What about a situation like this? Okay, I'm just thinking about what Bill is saying. Some short-term training programs, Pastor Lumbwe. How about we gather the pastors and we do
exactly
a training which is directed for them to do a prophetic conference? Can we address all these issues?
You know,
I know I'm picking a fight. I know I'm picking a fight.
No. Those short courses are very important, especially.
Yes.
You know, so we talk of maybe you can have a certificate and then a diploma, a degree, a PhD, and so forth. But
yeah, we need short seminars to like you said. You know, Dr. Connie, sorry to interrupt you. Like you, I heard in your response, Pastor Lumbwe, you kept saying ill-equipped, 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 and you can tell that it's the issue of course, when you're not well or equipped or something, go there. You know what I'm saying?
Yes.
So, on the basis of the same question, the way forward for the church, what would you say is the way forward, Pastor Lumbwe?
It's like what you are preempting, Vanathan. There is we can't deny, there is obviously a lack of knowledge of the nature and extent of drug abuse. You know, at present, really limited information on drugs and drug abuse, of course, being incorporated into the school curricula. But when studies on drug abuse, on attitudes and reaction to abuse, UNESCO initiated, requested and initiated something like that because of the rising public awareness. It became apparent and very clear that a drug abuse problem has started to develop big in Zambia, even though it has not reached very serious proportions, but I think now it is alarming. This demands a lot of new preventive efforts, which should include education. It must include information and research components like what Dr. Osborne is bringing out. But we are saying, let it be multi-sectoral in nature. When we talk about HIV, the way we have been combating the approach to HIV and resources that have been pumped into the HIV, you will see there are short courses here. There are people that are being specialized in the same. There are seminars that are being called here and there. That has been the approach. And that is what has helped to harness and combat this scourge at that level. we need to approach the problem of alcohol and drug abuse the same. And when it comes to clergy and the constituencies that we coming into contact with, let there be information on the tips on our hands as clergy, and like just getting a blanket on it. Can we go in fully equipped? It doesn't hurt to have seminars put up there. It doesn't hurt to have short courses done. We need to be very deliberate and intentional about it. And I am really prepared to see that we begin to put clergy together to mobilize the clergy together, because the constituencies that we are handling, they are massive, and people have so much in Zambia. People have so much confidence in the pastor. We hear a lot of things. People, they may not tell anybody in the family, but they will come and tell the pastor. We hear a lot of things. And so they are confiding in this person that is even ill-equipped in the same to be able to offer solution. So the only thing that they would do to them is just to mess them up, mess them around with all these things, and maybe take advantage of them. We need to come to a place where we are going to put a stop to a lot of nonsense that is happening. Yeah.
I agree. It
Here
has
are a
to
few
be
comments from the people watching. Watching. This is from Rachel, watching from the UK. Timely subject for discussion. Too much stigma associated with the substance alcohol abuse. Education and sensitization of the community is paramount to break the stigma. Comment on stigma, Dr. Connie?
Oh, yeah. Yeah, there is stigma and discrimination associated with the problem. And it's worse if it's a woman. You'll find, like, when it's men who are alcoholics.
Why?
Well, I think culturally, a woman is not supposed to be like drinking or be, with drugs. Although I must say, when it comes to young people,
now, today,
the girls and the boys are just equally bad. But from my generation, it tended to be more men, and so yeah, there's a lot of stigma. I mean, if you're alcoholic, my goodness. Yeah, people won't. First of all, you won't get a job.
Here's another one. From Richard. Good. I stand to be corrected. Pastor, comment on the rise of alcohol consumption among females in Zambia. I noticed this in my family members. Richard, you want to comment on that, Pastor?
I just did allude to it, Vanethan, much earlier. That's why I was saying that when we were talking about Zambia being a transit and how things have skyrocketed now, this is not just amongst men. That's why we're saying it has gone out of control today, because women have joined now. Dr. Connie, he's just saying it used to be looked at as a taboo. Everyone would just stand up and say, you're just a woman. But people are doing it shamelessly, unlike in the old times when only men were seen to be taking. Today, it is even a pride, even amongst the adolescents. So this is going on. We need to nip it. We need to address it. We need to put in mitigation measures. And the problem is, sorry to say, last week I was in Lusaka and we're discussing, and one of my friends, a clergy, strongly just comes up and talking about how he goes out to drink. There's nothing wrong around it. And look, if we are going to compromise it from the pulpit, how much more in the followers? So there must really be something that we really need to stand up to and be able to fight together in order to win this. Yes, I agree with you that there is serious rise and increase of alcohol consumption amongst females here in Zambia, not only in Zambia, but I think world over. Yes, Dr. Connie.
Yeah, that brings me to the issue of HIV and drug and alcohol abuse. And one of the driving, one of the things that drive more HIV in adolescents and young women is exactly that, drug and alcohol abuse. Because when you are drugged or you are drunk, you become what shall I say? A victim.
The guard is lowered.
Sexual assault. Sometimes even they just gang rape you, and you're not in your senses. So we have a problem of HIV in young people, in particular adolescent girls and young women. It is because of this rise in drinking alcohol and drugs as well, apart from other reasons, but that's one of the reasons.
Wow.
So yeah, we have a serious problem.
There are people, Miss Priska, Priska from Baltimore says good morning. Apostle Lumbwe says good morning. Is watching, following. Hi, Chisoma. You need to write a big check on this project. And what do you call it? Miss Priscilla Moya is also watching from Zambia, and a lot of other people are watching and following the discussion. Serious conversation. Do we have Alcoholics Anonymous in Zambia?
Yes, yeah, we do. We do.
How effective is it, and how widespread is it?
No, I don't know. I see adverts in the papers of Alcoholic Anonymous. One of the things that we need to change in Zambia is the fact that, health people are not allowed to advertise the services that they provide. So you have an alcoholic, or you have someone who abuses drug. You don't know where to refer them to, apart from Chinama, which is overloaded. So I think this
and stigmatized.
Yes, and Chinama is stigmatized. But there are Alcoholic Anonymous groups. There are places where you can go to be helped, but these are by word of mouth. They should not be by word of mouth. They should advertise, so that we can refer our friends, relatives to them. There are groups, but we don't know where they are, unless they and they're not. Most of them are not allowed to advertise.
So help is available, but you don't know where to find it.
That's the thing. Unless you know somebody, if you know Dr. Paul Ravi, if you know Mr. Nsalamu from Chinama, but it should not be like that.
But it shouldn't be.
In any case, even when we have groups, we need more.
Yes.
We need more. Yes, we had a presentation from Mr. Nsalamu from Chinama. When you go to Kenya, there is a rehabilitation center for drug and alcohol abuse every 2 kilometers in Nairobi. Wow. Every 2 kilometers, you'll find a drug and rehabilitation center. We need something like that.
Yeah, I think also
what's the name
starting
of the person,
point.
Dr. Connie?
Mr. Nsalamu, Friday Nsalamu. He's a senior mental health officer at Chanama. Friday Nsalamu.
The other thing, as we wind up this discussion, about us forming a movement and just getting to the bottom of this thing. how many rehabs do we have? It's a two-part question. How many rehabs do we have? Then the question is, what is the problem with statistics in our country? A few years ago, not a few years ago, when MM was in government, we had the minister of, I can't remember, Lumbwe. I was trying to ask a question about unemployment in Zambia. He gets upset with me and he says, you are trying to be an alarmist. I said, I'm just asking for statistics. What is the unemployment rate in Zambia? They won't even give you that. So what's a problem with statistics in our country? Number two, how many rehabs do we have? What shall we do with this rehabilitation thing?
Well, I learned that only Chainama Hospital, we've only got one public rehab center. That's Chainama Hills Hospital. And that's overloaded.
That's
and
wrong.
Usually they keep them for 2 weeks, which is not enough. To be rehabbed, you
Rehabilitated.
need 6 months.
A minimum,
I don't know
yes.
the minimum. Yeah. So we've only got one, Chainama Hills. These other places they treat my symptoms, substance use disorders, like maybe you are hallucinating or something like that they give, but it's not rehab. Rehab, you need 6 months. And Chainama can only afford to do it for 2 weeks. We don't have, except for Chainama.
Lumbwe,
yeah.
What if we are going to form a movement? What's the way forward? Now I'm getting my friends here engaged. I think we need to go and some meditation. Yeah, Richard, everybody watching. Let's go in Zambia. What's the way forward, Lumbwe, here as we wind up this thing? I know there's a GoFundMe going around to raise money. What's the way forward? What should we do?
We need proper linkages. People
I don't know if we've lost him. Yeah, but
I
can come in. I can come in.
Yes, go ahead.
What we need is we need a national strategy on this. Right now, we have the first ever national alcohol policy, which was put together in 2018. It's due to be reviewed. And we are saying, some of us that are interested, that it should not just be alcohol. Alcohol is just a substance. It should be a national drug and alcohol, a national substance use policy, so that it encompasses that. And within that strategy, it should be multi-sectoral, as Reverend Lumbwe has said, because each and every sector has a role to play. The NGOs, they have a role to play. The strategy, it's levels. So there is the individual level, there is the family level, community, institutions, my teachers, what. And then you have that level now for policies, guidelines, regulations. The comprehensive strategy. So we can say movement, but if there is no policy,
so we need to engage, because you can't do without government. They are the policy makers.
Yes, you have to. Otherwise, you can't move. Very
important. Yeah.
Clear referral pathways, all those things, they need to be. I'm just reading from Rachel. So we need a national strategy.
Yeah, we do. Like she's saying here, clear referral pathway need be in place. A friend's son admitted to hospital had to be discharged 2 days later without referring him to China. He's home with a helpless mom. You see, things like that. I think we need
And
to have a
even
situation. Yeah, we need to have this.
I was going to say, even if he was referred to Chainama, they'll put him there for 2 weeks. That's not enough.
Oh, wow. Lumbwe, can you
And
hear us?
Chainama is overloaded. We need rehabilitation centers like in Kenya. I think,
yes, we
you know,
do.
I'm cooperating partners. You know, help us for a high-level visit to Kenya to see how have they done it. What kind of policy they put in
it's
place?
important.
Yeah, you know. So
it seems to be having problems.
The policymakers need to go and see how others have done it. And Kenya is a good example.
I think you need to connect me to those people in Kenya, Dr. Connie. You need to connect. Here's what Priscilla, she's saying, I have a nephew who is alcoholic. Just a few weeks ago, he was admitted at Levy Hospital. He has a clot on his brain caused by the abuse of alcohol, and he was only admitted for 2 days.
Yeah,
so there we go again with the same issue.
No, it's
Well,
bad.
ladies and gentlemen, before...
No, it's okay. Go ahead.
Yeah, I wanted to just inform our listeners that we are launching a new show on Thursday evenings, 20 hours Zambian time. 2 young people will be dealing with that show, and Dr. Connie, and they say these are some of the things they want to address. So join us on the faith every Thursday at 20 hours Zambian time. We shall be putting information to let you know. Okay, let's conclude here.
The link will be shared. So do we use the same link? The same link that you shared today is the same link for Thursday?
No, it will be a different one. We shall definitely be sharing that for everybody. Pastor Lumbwe, you have the final before we go. Your thoughts before we go? Pastor Lumbwe, you have your final word before we go? Okay, I think it's frozen. Well, I know we have just... Okay. Yeah, go ahead. Okay, let's do this. Remove the video and then you just do voice. Even the voice will be able to hear you.
Okay, like I was saying that, you know,
okay, it seems like my friends in the Pentecostal movement will say the devil is a liar. I've thrown a lot of punches at my church people today. I don't think they are very happy with me. Well, you see, the reason I say that, Dr. Connie, is because I think the church needs to do more than it's doing. We need to step up and challenge ourselves. Very important. Yeah.
The church is very
important.
Pastor, we
speak. You can speak. We can hear you. Yeah, the church is very important. Okay. We need to hear. Sorry about that. We shall try to conclude next time. Everybody, that's our show today. Combating drug and alcohol abuse in Zambia. It's these are some of the things that we shouldn't shy away from, and it's a responsibility all of us to take, and you know, just say, look, we can't let our nation, because like somebody said, the generation wiped out here. If we are not careful, it will be wiped out. Dr. Connie, thank you as always.
You're welcome. Happy to be with you, and I'm available for...
Yes, I'll be getting with you.
As long as they are health related.
Yes. Yes, I'll be getting with you all the time. And Pastor Lumbwe, thank you as well. we have come to the end. Sorry.
Thank you very much.
Just a few words before you go, Pastor. Yeah, a few words before you go.
Right. Thank you, Vanathan. This is a very, very important subject. Thank you for inviting us. What I want to encourage everyone is that we need to break working in isolation. We need to come together. There are a few pockets of people that are doing things here and there. It's not really it's not that there's no one that is doing something. People are doing something. There are individuals, there are private people, NGOs that have gotten to be doing, they have put up rehabilitation centers. People are getting in there, they're getting help. People are getting there 6 months, 1 year. I've seen people come out, they have completely changed. And this has helped quite a number of people. But people are doing works in pockets, isolated. We need to come together. We need to have proper linkages for us to work together and have one voice. So we need to be very deliberate and intentional to be able to harness all these efforts that are being done in different corners and supplement what government is doing. And we just hope that they can expedite the work that is being done. They told us, Drug Enforcement Commission told us that land has already been secured. This is a multi facility that is going to be put up. There is already political will around there, but we just hope that this is going to happen very soon. Land has been secured. They want to put up something very massive. Budget has been approved. So we just pray that this is going to be expedited. But apart from what government is doing, we need to come on board and be able to put our efforts together and be able to do proper linkages around in order to combat what is befalling us. Yeah.
That's true. I look forward to seeing a big conference of clergy and the church to deal with this issue. I look forward to seeing much. We shall help and put in some fun. Thank you, Dr. Connie. Thank you, Lumbwe. Have a great week.
Thank you. Great.
You too.
All right.
Yeah. All right.
Thank you. Bye.
All right,
okay,
everybody.
Goodbye.
That was our show today. Yeah, look forward for Thursday's show. We shall put up information. Join us next weekend at the same time. Bye-bye.
Zambia Blog Talk Radio.